This Good to Go segment is sponsored by Spectrum Health Medical Group.
This segment is sponsored by Spectrum Health. As the COVID-19 pandemic stretches on, we know that our healthcare resources are in demand like never before, at least for folks who are presenting with concerns or symptoms of the coronavirus. But what if you were experiencing chest discomfort? Would you go see a doctor right now, or try to ride it out because you know they're busy with other things, or you're worried about contracting the virus yourself? These are real concerns. And Dr. David Wohns is here. He is a cardiologist with Spectrum Health, and he joins us to talk a bit about that. And welcome to you, Dr. Wohns.
Thank you, Catherine.
In light of the coronavirus, are hospitals safe to go to now?
They are, and I mean, great question. We are very concerned that patients are having symptoms and fearful of coming to the hospital or seeking care. And I want people to be confident that we're taking every measure we can to ensure their safety when they come to the hospital. That involves a variety of factors. One is all of our employees and all of our team members, when they're coming in, are screened every day. And so we've got a very rigorous screening process in place every day for all of our providers and team members before they come into the hospital. We're following, we have very limited visitor policy at this point, which is hard on our patients, but it helps to keep everybody safe. In all settings, we're following social distancing, masks that are appropriate for the location, including protection, that is surgical sorts of masks and N95s, but we want everybody in the hospital wearing masks. So we are doing everything rigorously to assure safety for both our patients, for all of our patients coming to the hospital.
We've certainly heard a lot about people with pre-existing conditions being at perhaps greater risk with this whole COVID thing, COVID-19. What about people with heart disease? Do they have reason to be extra worried?
We don't want people worried, but we want them very cautious, and yes is the answer to your question. We know while COVID-19 is primarily a respiratory disease that spreads readily from person to person, for people with underlying heart disease, and particularly those over 65 with coronary heart disease or hypertension, that we know these individuals are more likely to become infected and more likely to develop severe symptoms if they are. So while we know that everybody needs to follow protection during this pandemic, it's especially important for those more vulnerable, which is people with heart disease, hypertension, coronary heart disease, over 65, to fully follow the recommendations for social distancing, for hand washing, staying at home, avoiding gatherings, and if they have symptoms, should seek advice and care. And one symptom that overlaps with COVID is shortness of breath. So it is one of the symptoms we screen for with COVID, but it can be a sign of heart disease. So I would tell people that are having chest pain or heart disease, don't fear getting attention, don't fear getting advice. We are here for them. Call our offices, talk to your doctor. If you're having symptoms of a heart attack, 911, come to the hospital. We are seeing many people delaying treatment with adverse consequences. We do not want that.
I've talked a lot about telehealth right now in this pandemic. When is telehealth appropriate when it comes to cardiac issues, if at all?
Great question. It is appropriate. 911 for serious symptoms. So what I've just outlined, 15 minutes of chest pressure, shortness of breath, sweating, that's a 911 call. Telehealth, such as what we use at Spectrum Health now, and all over the country, people are going to telehealth, is a great option for patients not experiencing an immediate need or with symptoms that may come and go that they're uncertain about. Shortness of breath is a very common symptom, and again, it can be a sign of other things. Telehealth is a perfect opportunity to connect with the physician or provider to sort out whether those symptoms warrant further testing, possibly outpatient. Our goal is not to just send people to the ER, only those that need it.
Yeah.
And we have lots of options through telehealth. So I think people are often thinking we're not available or are afraid. We are available, and seek attention for those symptoms and get advice.
Dr. Wohns, thank you for spending some time with us. Such important information. And if folks want to learn more about COVID-19, they may do so on the Spectrum Health website. We have put a link to it on ours. Go to 13onyourside.com. You'll find it there.
Thank you, Catherine.